Man sacrificed his health in order to make money. Then he sacrifices money to recuperate health. A quote there often attributed to the Dalai Lama, but whether or not he said it, it certainly rings true. Welcome to this health-focused edition of Jamaica Magazine. I'm Adrian Atkinson, and today we encourage you to challenge yourselves to make the right decisions where your health is concerned. From matters surrounding H1N1 to autism to obesity, we've got you covered. Stick around as we head to this important message, followed by the news.
This is the Aedes aegypti mosquito that spreads the Zika, chikungunya, and dengue viruses. Search for its breeding sites and destroy them. A message from the Ministry of Health.
Good day, I'm Lorraine Mendez, and this is your JIS News for Tuesday, April 5. Government is moving to cut the numbers of domestic homicides recorded on the island. Domestic violence accounts for 30% of Jamaica's murder cases, but the Jamaica Constabulary Force is partnering with Women Inc. to reduce those numbers. On Monday, they launched a domestic sexual and gender-based violence project to train police personnel and other stakeholders to recognize their role in protecting victims of rape, sexual harassment, and domestic violence.
It is our expectation that this project will further equip and empower our police personnel to be more effective in dealing with this type of crime, and to apprehend and secure the conviction of those who are guilty of these offenses.
The project is being funded by the British High Commission and the United States Embassy. As the island celebrates Farmers' Month in April, Portfolio Minister Kyle Samuda is urging producers to improve product quality to stem imports.
We have to take charge of our own destiny. We have to start to encourage our local people to produce efficiently, competitively, so that we don't have to rely on other people abroad to buy goods from.
Minister Samuda was speaking Sunday at the launch of the 33rd anniversary of Farmers' Month. He also called on the church to play a more active role in pushing young people into farming, which he believes will reduce violence.
Use your efforts, your energies, to encourage more young people to participate in a real way in the building of this great country of ours known as Jamaica. And if we're doing better, it means more people are employed, and if more young people are employed, they will find less time to get themselves in trouble.
The national diaspora policy is currently being reviewed with a view to implement it as soon as possible. That's the word from Minister of Foreign Affairs and Foreign Trade, Senator Kamina Johnson-Smith. She was speaking recently at the Jamaica Diaspora's second Advancement in Education Summit. Mrs. Johnson-Smith said the policy was important in providing the framework and climate to ensure effective engagement and partnership between Jamaica and its diaspora.
The policy will aim to build an environment of trust and cooperation between the diaspora and Jamaica and among diaspora groups in host countries. It will be geared at promoting the involvement of the Jamaican diaspora in enhancing Jamaica's image and profile worldwide, and create an enabling environment which stimulates the diaspora's involvement in economic growth and the social development of our nation.
It is estimated that the Jamaican diaspora is made up of more than 3 million people. Meanwhile, at the Diaspora Education Summit, Education Minister Senator Ruel Reid said the Early Childhood Commission was on an accelerated drive to increase the number of certified early childhood institutions on the island. This is partly to address the low number of basic schools that have so far reached the certification standard.
One of the hindrances to achieving certification status is the standard of the physical facilities, the school plans. The National Education Trust, which the institution and government has set up to assist in garnering resources and support for investment in education, will continue to partner in this regard.
And finally, Tourism Minister Edmund Bartlett is in the United States, where he's conducting stakeholder meetings with key partners. Minister Bartlett's first stop will be at the Jamaica Tourist Board's advertising agency in New York and New Jersey. The trip is the latest in a series of stakeholder meetings that the newly appointed tourism minister has conducted since taking office last month. Already, he has met with key tourism groups including the Jamaica Hotel and Tourist Association, Red Cap Porters Association, leaders of the attractions and ground transportation subsectors, and employees of the ministry and its agencies across the island. Minister Bartlett left the island on Monday and returns this Friday. And that's it for JIS News today. I'm Lorraine Mendez. Thank you for watching.
Experiencing flu-like symptoms such as coughing, fever, or runny nose? Has it caused severe aches and pains? Is it difficult to breathe? Have you been feeling dizzy? What about diarrhea, vomiting, or dehydration? If the answer is yes, see your doctor or the nearest health center right away. These are all symptoms of the influenza A H1N1 virus. Be smart. Seek medical attention today.
Influenza A H1N1 is a respiratory infection with similar symptoms to the common flu, and the Zika virus Zika is a disease spread by the Aedes aegypti mosquito. There are cases of both H1N1 and Zika on the island, and the government has been proactive in its responses. How? Watch this.
In January, the Ministry of Health informed the country of the first confirmed case of the Zika virus in Jamaica. Shortly after, increased cases of influenza, particularly H1N1, was also confirmed. In response, action is being taken on several fronts to protect public health. Influenza or the flu is a viral respiratory illness usually resulting in symptoms such as fever, sore throat, cough, stuffy nose, headache, and body aches and fatigue. While most people generally get over the flu fairly quickly, it is estimated that over 56,000 persons die each year from influenza and pneumonia-associated complications. Here in Jamaica, the Health Ministry has confirmed a number of deaths associated with the influenza A H1N1 virus this year. To curtail those numbers, intervention was expanded and accelerated. As a first step, doctors were mandated to notify the ministry about suspected cases of severe acute respiratory infections, including H1N1, within 24 hours instead of the previous stipulation of 1 week.
And then we also sent out what we call a case report to remind physicians of what we're looking for and who would be a suspect case. So they don't need to be confirmed. If you suspect, we want to know within 24 hours.
The supply of flu vaccine has been beefed up, with frontline healthcare workers encouraged to take the shot. And looking to the next flu season, Health Minister Dr. Christopher Tufton has mandated that more flu vaccines be ordered to cover all healthcare workers as well as members of the population in the high-risk groups for severe complications.
And that would include the elderly, persons, women who are pregnant, children, and those with chronic illnesses like asthma, high blood pressure, diabetes.
Other interventions include preparing isolation areas in hospitals, procuring additional equipment, and increasing testing capacity for the H1N1 virus. Additional supplies of Tamiflu used to treat H1N1 has also been acquired through the Health Ministry, while a new policy decision was taken to make the drug more widely available.
We wrote to the pharmaceutical importer. We asked them to bring in more to have it available in hospital pharmacies so that consultants would be able to prescribe this.
That decision was expanded to allow importation to private pharmacies.
Of course, you would need to have a prescription by a physician, and in the same breath, sending out the information to physicians around the country as to who we recommend should get Tamiflu. So we really don't want it to be everyone, or soon you'll have resistance being developed towards the product, you know.
Public education has also been a big part of the ministry's response mechanism, with constant messages urging persons to observe proper hygiene practices and take other measures to prevent infection. These include cleaning hands frequently with soap and water, covering one's mouth and nose when sneezing or coughing, avoid touching your eyes, nose or mouth with dirty hands, and avoid contact with persons with flu-like symptoms.
So we really want to ensure persons get more serious about protecting themselves.
After confirming Jamaica's first case of the Zika virus, a number which has subsequently gone up and is expected to increase further, the Ministry of Health has been busy trying to eradicate the vector. As the virus is spread by the bite of an Aedes aegypti mosquito, the major thrust of the intervention has involved destroying mosquito breeding sites around places where people live and gather.
And so we increased our fogging in these areas especially, in addition to the routine fogging being done in all areas within the country.
A national cleanup campaign dubbed Operation Mosquito Search and Destroy was launched in Portmore and Spanish Town and has already been to Ocho Rios, with Mandeville next on the agenda.
Because fogging only kills 30% of adult Aedes aegypti mosquitoes. So we needed to get out to the public that it is the breeding sites that we need to destroy to not have more adults coming. You can't depend on fogging alone. In other words, this is far more than a Ministry of Health issue. It's about you and your home, your environs.
The ministry is also receiving help from local stakeholders as well as the Pan American Health Organization, with one of the biggest results being the upgrading of the University of the West Indies Virology Lab. That lab, which is a national influenza center, means Jamaica is now equipped to conduct local tests for the Zika virus.
The waiting period to determine infection has been significantly reduced.
Public education is also a big part of the ministry's Zika virus response program.
So what is it that we're asking you to do? We want you to make this a habit. Once a week, search for and destroy the breeding sites of the Aedes aegypti mosquito.
For more information on the influenza A, H1N1 virus or Zika, contact the Ministry of Health or the nearest health center.
Yes, indeed. Washing your hands the right way is critical in limiting the spread of a number of diseases. How aware is the general public, though, on some of the preventative ways of spreading the flu? We head out the road to find out.
Wash my hands, Keep my hands clean whenever I'm eating or drinking. I have carry-on sanitizer.
I've taken vitamin C, wash my hands regularly, so I've been doing that.
Keep safe by washing your hands most of all, because disease and infection is transmitted by person to person. Coughing and stuff like that, make sure that when you cough, your hand over your mouth and stuff like that. Make sure that your area is safe and your kids are safe, and make sure you do proper hand washing with them, because mostly germs and infection viruses mostly take onto children because they play a lot outside and stuff like that.
We don't have no control over them things there, because them things they flying out of here, sniff it up or something like that, so we don't know.
Probably eating properly and build up your immune system that you don't catch a flu. Probably what I do is drink a lot of lemon juice in the mornings, so whenever I get the flu, the cold, it don't really stay with me.
So you have to keep your surroundings clean, wash your hands, and when you're preparing the meals, you have to make sure that it is well looked after.
Sometimes try to avoid crowd, for people might be there with it, right?
Just stay clean and keep yourself clean. Wash your hand and rotate it,
Yeah, you have to take like your vitamins and stuff, and try to keep yourself to yourself, because you don't know who have it, and if you see a person sick, like them sick, you can't attach yourself to them. You cannot distance yourself at times.
Wet hands with water. Apply enough soap to cover all hand surfaces. Rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Backs of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb clasped in right palm and vice versa. Rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands with water. Dry hands thoroughly with a single-use towel. Use towel to turn off faucet. Your hands are now safe.
Do you or someone you know have a disability? Do you want to start a business or need some financial help for an already established business? Then we've got you covered. The Ministry of Labour and Social Security through the Jamaica Council for Persons with Disabilities offers grant funding to individuals and groups under its Disabilities Economic Empowerment Grant Program.
You have to be registered with the Jamaica Council for Persons with Disabilities. For persons doing the business, you must have a business plan. You must have your TRN, and the business owner from which you are purchasing, or the supplier from which you are purchasing, they must have their TRN also.
Get on the path to economic empowerment and independence. You have the ability. For further information, contact the Jamaica Council for Persons with Disabilities at 968-8373, 926-9374, or visit their head office at 18 Ripon Road.
April is being observed as Autism Awareness Month, and so as we continue our health focus today, we speak with one special needs expert on issues surrounding children with autism and their sexuality.
First of all, we need to recognize that children with autism develop sexually like all other children, no difference. And because of the uniqueness of their situation, where they like routines and they don't like changes, we find that the period of puberty is particularly challenging for our children with autism. Parents will need to recognize that every single child with autism needs to understand the proper names of body parts. If the parents, as first teachers, don't pass that information on, then the children are going to get a lot of misinformation. Not only will they get misinformation, but they may develop inappropriate sexual behaviors. Parents will have to learn how to use replacement behaviors, so that a child who is doing something inappropriate in the public, for example, let's say, for example, a boy who may be masturbating, the parent will understand that give that child something to keep him occupied. For example, maybe holding onto a sponge ball or a squeezer or a tweezer or something to keep his hand occupied so that he's not using it in an inappropriate way in the public domain. Girls, for example, who are going through their menstrual period, that's a big change for them, lots of confusion. Parents will have to teach them step by step how to manage those changes and not to get anxious and develop inappropriate behaviors. Social stories are those stories in which we are going to use real-life situations and even the names of the child in the story to help the child to understand the concept that the parent is trying to get across. Videos are also very helpful in that kind of situation.
Sometimes even the greatest joys bring challenge, and the children with special needs inspire a very, very special love.
few seconds of discomfort is better than a lifetime or many years of serious, excruciating pain. I appeal through this medium to my fellow men not to be afraid of any of the checks, the DRE or the PSA. It's for your own benefit, your own welfare. It can be prevented. You don't have to die, and you can live a good quality of life. Early detection, following your doctor's advice, and if you find that you have the cancer and you have your surgery or whatever method, just change your lifestyle to suit the occasion.
Know your numbers and control the keys to a healthier heart. Know the numbers for your blood pressure, cholesterol level, blood glucose level, and your weight and body mass index. Find out the risks they represent and what you need to do to stay healthy. Talk to your doctor and start making healthy lifestyle choices to prevent a heart attack or stroke.
Okay, so we're way past the new year, but what about those New Year resolutions of getting fit, eating healthy, and staying in shape? Perhaps you, like many of us, have fallen off the wagon, or worse, you didn't get on. But listen, there's hope. You can start today because, as you'll next find out, obesity is a weighty matter.
Overweight is defined as having an excess amount of body weight, but that can occur from increased amounts of muscle, bone, fat, or water, whereas obesity is defined as having an excess amount of body fat.
The excess fat that leads to a diagnosis of obesity mainly occurs when the body takes in more calories from foods than it is able to burn through exercise and normal daily activities. The result is a major health threat, as obesity is usually accompanied by other issues, such as type 2 diabetes mellitus and non-communicable diseases such as hypertension, heart disease, stroke, and various cancers.
Obese men are more likely than non-obese men to die of cancers of the colon, rectum, and prostate, and obese women are more likely than non-obese women to die of cancers of the gallbladder, breast, cervix, uterus, and ovaries. There are other conditions like gallbladder disease of different kinds, which are associated with obesity.
Infertility and poor quality of life can also result. So diagnosis and management of obesity is of enormous significance.
And there are ways to assess it. The commonest way to assess obesity is by using what we call the body mass index, or BMI. And the BMI is essentially your body weight in kilograms divided by your height in meters squared. And we have scales to judge what your weight status would be. Less than 18.5 BMI would be considered to be underweight. Normal weight is 18.5 to 24.9. 25 to 29.9 would be considered to be overweight, and BMIs of greater than 30 are all considered to be obese.
It's generally easier to gain weight than it is to lose it, which means avoiding practices that lead to excess fat consumption is the easiest route to avoiding obesity. But if you're already overweight, the process may be difficult, but it is achievable. You may need help from physicians, nutritionists, physical trainers, and even therapists, so you should seek them out if that's the case. Either way, most experts will tell you that weight loss requires behavioral change, lifestyle changes that are gradual and long-term.
The problem in our society, of course, is the same as anywhere else. Less physical activity, we're working harder, we don't have time to schedule exercise, and of course, unhealthy eating habits. So more fast food, less fruits and vegetables, less freshly prepared foods, and consumption of large amounts of sugar-sweetened beverages. So this is what fuels it.
Eating healthy helps to keep us healthy. Are you thinking about what would be a healthy and balanced meal, but just can't decide on what foods you should be having? Jamaica's food-based dietary guidelines can provide you with answers. The guideline from the Ministry of Health provides information for individuals, health professionals, nutrition educators, and the food industry. It encourages a daily diet of items from all the food groups. That should include fruits and vegetables, as well as peas and beans and nuts. And the things we ought to avoid are clear: excess salt, that is more than the daily recommended amount, as well as fats and oils and sugary foods and drinks. Also,
if you lead a sedentary lifestyle, then it's very easy for you to become obese because you're not going to be able to burn off the calories that you take in. And of course, if you eat unhealthily, you're more likely to become obese because your body's going to store all these excess calories as fat.
So one of the ways to counteract obesity is to engage in regular physical exercise, like going for brisk walks, jogging, swimming, or riding a bicycle. Regular exercises like these burn calories and get rid of excess fat and weight, helping to control blood cholesterol, blood sugar, and even high blood pressure. Experts in health services say children can be set up to become obese later in life. The Ministry of Health is working to address these issues as it focuses on key strategies to improve overall maternal and child health services. Don't be weighted down by obesity. Take charge of your good health. Eat well, exercise, and get about the business of living well.
Did you know regular physical activity controls your weight, reduces your risk of cardiovascular diseases, reduces your risk for type 2 diabetes and metabolic syndrome, reduces your risk of some cancers, strengthens your bones and muscles, and increases your chance of living longer? Get active, get fit, stay healthy.
With that tip, this is how we close the pages of Jamaica Magazine for today. It's been a pleasure to share with you and trust you feel compelled to take better care of your body and your surroundings. Keep in the know on this and all government-related matters by visiting our website at jis.gov.jm. You may also communicate with us through social media and by email. I'm Adrian Atkinson. Thank you for watching, and remember, your health is your wealth.
This has been a production of the Jamaica Information Service, the voice of Jamaica.